Doing well. I'm Dr. Milind. So, NICT counseling is about to begin, and yes, mock counseling registration has already started, and NEETPG counseling will begin soon. So, a lot of students have one question in their mind that what should I choose? I have a good rank in both NICT and state college. So, should I prefer AIMS over the state college? And what are the advantages and disadvantages of those, of the choices that I make? A lot of students they have they're confused because because the tag of AIMS is calling them, and definitely they are trying to compromise for the branch and get that tag of AIMS. तो डेफिनेटली कंफ्यूजन काफी लोगों के दिमाग में है एंड आई एम समवन कि मैंने एम्स में भी काम किया है. आई हैव वर्कड इन स्टेट कॉलेज एज वेल, so I have exposure of the adequate exposure of the both the places, and also I have been in touch with a lot of students who have done their graduation from both the places. So in this video, I will quickly summarize, and I will try to give you idea that what are the things that you should look for when you choose between AIMS and the state colleges. So let's start today's video. So first of all, I will try to tell you what are the pros of AIMS. You know what advantage you get if you do your PG from AIMS. And when I mean AIMS, all the AIMS include I mean AIMS Delhi and other peripheral AIMS as well. So the first and foremost, the most the advantage and the thing that attract about AIMS is tag. Second, yeah, the tag of AIMS it helps a lot, and it helps not only in super specialty exam but in your practice as well. Second thing is there are no bonds in AIMS. So once you are done with your 3 years of post graduation, you are free, and that is something which actually is different from a state college. Also, when we talk about AIMS, it definitely give a better research opportunities because in AIMS they always push you. I mean, it's not like you don't get those opportunities in state college, but the faculty of institute will always push you for that because the patient load is limited, so you have a lot of time to do your research. So I think that is something that AIMS offers you. Also, when you submit your abstract, I had released one video in the past about AIMS and AIMS versus peripheral colleges. So what I had noticed that whenever we used to submit our abstract, like being from AIMS, I had noticed that our abstract usually gets accepted in everywhere. Like in the conferences, it's like easily gets accepted, and I think that is the the tag of AIMS that helps getting that. So that is something I feel is the advantage of AIMS. And as I have said, good work and life balance. So state colleges actually, especially the top state colleges of all the states, they're overcrowded. Lot of patient load. I mean, it's more than required. So definitely the life, the work hours and and the usual life of a resident is definitely affected. But contrary to that, as AIMS has a one paid one patient policy, so good work life balance can be seen throughout all the branches, not only like branches like radio or derma, but also medicine, obs, gynae, and pediatrics can have a good work life balance if you talk about AIMS. And I know students who have taken AIMS because they don't want that hectic workload of a state. Academics, especially, this is something again AIMS will offer you. I remember when I was in AIMS Bhopal, we were always pushed for academics. There were always like classes, case presentations individually. Also, AIMS has a less number of PGs, so you will get more chance of presenting. Yeah, it's definitely challenging because you cannot keep presenting the case every time. But academics is definitely superior. Also, a lot of state colleges they have a good academics, like in Delhi colleges and other Mumbai colleges, they have a good academics, but the patient load is such that hardly student can attend those academics, and even if they are attending, their the brain is always occupied with the patients and everything, so you don't get that time to study and read about that academics. So definitely that hampers your academic growth. And lastly, good chances of getting into DM and MCH. So when you must know that there is a INICET super specialty exam. So if you're from AIMS, you have a better chance as compared to other students. I do not mean that other students are not getting the DM or MCH, but if you're from AIMS, it has some extra advantage. Now, what are the advantages of state college? So the first is like what is different from AIMS that you get a vast clinical exposure in a state college. The patient load is unlimited, and the kind of cases you see in a state college they are completely different from AIMS. State colleges already have a established infrastructure, so it's very easy because most of the state colleges that we have are very old, and so they have this routine and that established protocols. So it's a bit better than the new AIMS, I would say. Now, if we talk about casualty training, like when we all about dealing with the emergencies. State colleges have a better emergency infrastructure. That is what my personal experience over the years. Because usually AIMS gets referred cases, so you will always get half treated cases who are refractory, not responding, or very kind of high five cases, as we say, like very difficult cases. So you will not get like routine emergency cases in AIMS. On contrary to that, in state colleges you will have all the vast exposures of these emergency cases. So I think this is a added advantage of state college, that you get a better emergency training in state colleges. Also, the common clinical cases, I used to tell my friends that when I was in AIMS Bhopal, we hardly saw any like malaria cases, because they used to go to the state, I mean the college, the established place first. And if there are some cases which he needs to referral, like needs some, they feel that it's a complicated case or need some something extra workup or that, then they will refer them to us. So the common clinical cases, because see, the one disadvantage that a lot of students say about AIMS, that you have all investigations, you have everything at your doorstep. So when you go and practice on the like when you go on the field, like when you're practicing at your place, it is important to have a exposure of a common clinical cases, because see, you are not going to treat like syndromes, leukemias, and high five cases in your, like when you are established practitioner. You need common clinical cases. You should know how to treat dengue, enteric fever, and malaria. So that common clinical cases exposure is better in state colleges. Also, AIMS usually have a lot of investigations available. They have everything available. So it becomes handy that you order test, and the diagnosis, thinking takes a backseat. So in a state college, so that the limited availability of these resources become actually advantage, and you clinically you become better. So I think that is better with state colleges if we talk about common clinical cases. Now, what are disadvantages of AIMS? So if you talk about newer AIMS, so six initial AIMS were established, so they have now fully functional and they are quite good. But the newer AIMS which were established later, they're still evolving and they have limited infrastructure. So especially for surgical branches, you have to be careful when you're choosing those AIMS. Now, as I have said, inadequate exposure of common clinical cases, that is definitely with AIMS. Less emergency cases exposures, you will mostly get a referral cases, and also you do not have lot of beds available. So even if you have a good case, you will have to refer them back. And as I have said, the academics is good, but as you are always under pressure, especially names they lead in, like because you are among this top cream of the among the brightest minds. So sometimes it's not like you always want to do these all case presentations and everything. So you'll always be academically challenging, and sometimes it becomes difficult to keep doing this thing. So that is, I feel, that can be, some students might find it very frustrating. And if we talk about state college, so the vast patient load, which gives you a very good clinical exposure, actually can be overwhelming at times, because it becomes, some students are not able to handle that load, because it's like, you must have seen that, especially the Delhi college, the load is never ending. The emergencies are always, fully functioning, and they are like overflowing, and it becomes difficult to handle that load. So sometimes you don't even know what you're doing. What you're doing is right or wrong. Even what you are writing treatment where the patient is, getting that on time, because there is so much of load, so much of crowd, that it becomes difficult to get idea about that. Also, especially the state colleges have a slow growth. So if we talk about branches like radio diagnosis, which requires a good infrastructure, so there were a lot of state colleges which did not have MRI, and still there are colleges which do not have MRI or CT machines, and it becomes difficult. So AIMS have a better potential of a growth as compared to state colleges. Bonds, again, a very very important factor, which is a disadvantage of state college. A lot of states have bonds, and it becomes difficult for a non-native students. Also, salary, the central institute, the AIMS usually offers you a better salary. Some state colleges, they have a very bad salary status for the residents. And again, academics, as I have said, first of all, there is a less academics in most of the state colleges. And also, whichever colleges are trying to put that academics, because of the overwhelming patient loads, it become difficult for students to attend and keep give attention to the academics. Lastly, so when you are filling the form, now you have a confusion that with no, I should go for AIMS or I should go for a state college. So I have few words of wisdom which might help you. first always choose branch or college, no matter how attractive. It's not like if you want to do pediatrics, if you're getting a pediatrics in some good college in state, and if you're getting CFM or let's say anesthesia in AIIMS New Delhi. So don't just go for the tag of AIIMS Delhi, because AIIMS New Delhi is going to be with you for 3 years. The branch is going to be with you for lifetime. So whatever your branch you want to pursue, you can always do that. There is one rule that I follow, that if you want to do your junior residency in AIIMS, like I did my MD in pediatrics from AIIMS Bhopal. So now I feel that I have limited emergency exposure and I have limited common diseases exposure. So I have joined a good the state college in Delhi, so which is actually a central institute only, but there I get adequate exposure. So you do your PG from AIIMS, and then you do your SRship from a good, peripheral, I mean, a state college or a college which has a good patient exposure, and vice versa. If you have done your residency from state college, you can go and do your senior residency in AIIMS, where you learn about the protocols. You are actively involved in academics and research. So it's like the learning is a continuous process, and just don't go to with that mindset that if I am choosing a branch or or a college, now I have to stay, it's like for a lifetime. Next 3 years will be important for you. So even if you don't get the college that you want, you can always choose SRship in a better place. So if you want to put a order, like if you want me to put a order of AIIMS and state colleges together, I'll say definitely AIIMS Delhi is the best. AIIMS Jodhpur is the best peripheral AIIMS as of now. If you have seen the NIRF ranking, even AIIMS Jodhpur is top, amongst the top colleges, followed by AIIMS Rishikesh. Then AIIMS Bhubaneswar, Bhopal, Raipur, and Patna, they are at equals, I will say, at same level. And you should choose as per your convenience that which city you want to go, and because and also the language and the place that you want to pursue your graduation. After that, top state colleges, all like Mumbai, Delhi, Chennai, Bangalore, Kolkata, all your top state colleges, you can consider them after this, and then rest of the AIIMS, and then rest of the state colleges. So I think this is the order that you should follow, and depending on the branch that you are getting, you should keep this order in mind. Lastly, listen to what you want to do in life. Whatever I am saying or whatever anyone else will say, yeah, that is there, but you have to practice for the rest of your life. And whatever you will choose, trust me, even if sometimes we have to compromise, we don't get the branch that we want. Practically life is very different. I have seen people who, I never thought I will be a pediatrician. There are a lot of students who were very passionate about pediatrics. They took pediatrics and then they left. There were students who were very passionate about a particular subject, but they thought they liked that subject a lot, but later they left it because they realized that is not something that is suitable for the lifestyle. So it's okay. You can, think what you want to do in your life, and whatever your heart says, whatever branch you think that you want to pursue in life, go ahead with that. So I hope this video will help you. I wish you all the best and take care.